Nih, Mas. Oh, Mas kena buka. Tak dengar. Enggak. Paham dah. Paham. Thank you. Start now lah. Enggak lagi. Doktor No bagi arahan lah. Okay, thank you. First time. Minta maaf saya kalau ada apa-apa kesilapan. Hello. A very good morning to our honorable guest, Datuk Dr. Abdul Aris bin Muhammad, HSAPZ Director, or the Deputy Hospital Director, all head of departments, specialists, and the rest of HSAPZ staff. First and foremost, I would like to thank everyone for allocating time listening to the CME today. I'm Christine from Physiotherapy Unit, will be your MC today. Before we start our CME today, I would like to give few announcements. To sign in for attendance, kindly scan QR code on the screen that will be displayed before and after CME section. Or you can use attendance link at live chat in YouTube channel. For those who join the CME via online, any question can ask at chat box in YouTube link. We are very fortunate to have Dr. Zubaida binti Zulkifli, anesthesiologist specialist, who will talk about the separation that unites us. Without further ado, I would like to invite Dr. Zubaida for her thoughts.
Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to everyone. First of all, thank you very much for coming to my presentation today. Thank you to Ms. Christine, our chairperson today. Without further delay, shall we start our presentation? Before that, you can scan the QR code for the attendance. Okay, this is my topic for today, the separation that united us. So what is this all about? I know everyone here has been wondering what is this topic all about. I would like to declare that this has nothing to do with current political issue, and I'm not the representative of any of this party. Here is my real business today. The thing that I really want to share about this conjoined twin. On 19th of March 2022, I had the opportunity to involve with one of the emergency premature twin separation that was done in Hospital Tunku Azizah, Kuala Lumpur. So today I would like to share the experience dealing with this unforgettable case. Well, this separation, no doubt, had united us nationwide. Different specialists from different fraternity all over Malaysia, such as from a neonatology unit, pediatric surgery, pediatric anesthesiology, pediatric radiology, were involved in this separation. No doubt, this separation actually brings joy to all fellow Malaysians. Before we proceed further, let's learn a bit about a conjoined twin, or known as Siamese twin. It is actually a rare phenomenon of monochorionic monoamniotic twins, which means we have one amniotic sac with one placenta. So the incidence actually varies from 1 to 50 to 100,000 live birth, but in Southeast Asia and East Africa, we can see the more frequent incident, which is about 1 to 14 to 25,000. Female more prominent, which ratio 3 to 1, and majority of our conjoined twin separation was done at elective age between 3 to 6 months. So there is certain situation when life-threatening condition that require emergency separation. However, emergency separation in earlier age associated with high mortality, which is up to 80%. In utero death was reported about 28%. Soon after birth is 54%, and only 8% survival rate. So when is emergency separation required? So when there is presence of surgically correctable life-threatening anomalies. Example, if one of the twin had certain condition like congenital heart that require urgent correction, so no doubt we have to spread earlier. And another indication is serious illness in one of the twin that threaten life of other, and traumatic injury to breech or visceral organ that compromise the circulation in between these two twins. Let's recap a bit on history of conjoined twin. Okay, the most famous conjoined twin in history is Ng and Chang Bunker. They were the first named as Siamese twin. They actually born in Siam. That's why they were named as Siamese twin, because of some superstitious belief. They bring bad luck to the family, to the nation, force the parents to migrate and bring them to the United States. And from there, they actually live well up to old age, up to 63 years old. Okay, the first successful conjoined twin was performed by this Swiss surgeon in Switzerland, Dr. Fatio, between 24th of November and 3rd of December 1689. Unfortunately, this Swiss surgeon was able to publish his work because of some violent political, he was executed because of the political violence. However, these two persons here, Emmanuel Koenig and Theodor Zwinger, was present during the separation, and they were the responsible person that published the work by Dr. Fatio in 1689 and 1690 respectively. Okay, this is Ng and Chang Bunker. Their life actually depends on each other because they share circulation. So eventually, one of the twin, which is Chang, died first, and subsequently after 1 hour later, Ng also passed away because they shared circulation. A little bit conjoined twin in Malaysia, we have 25 cases recorded in Malaysia since 1981. Malaysian journal, medical journal, 1996 had reported successful separation 6 set of conjoined twin from 1988 to 1995 in hospital Kuala Lumpur. However, a 4th set of twin, which is omphalocystophagus twin, died after 1 week because of post-operative complication. And the 5th set, one of the 5th set actually died because of the cardiac complication 3 months post-operation. The first conjoined separation by local expert was in 2002, which is 20 years back. So subsequently, which is the twin name Azama and Azami, they are separated at age 7 months old. Subsequently, further advancement of our medical technology and expertise in Malaysia has allowed more complex cases to be done with a better outcome. These are the classification of conjoined twin. We actually classify according to the location where it get conjoined. So thoracophagous fuse the joint at the thorax, omphalophagus joint at the lower abdomen, pyophagus at the back, ischiopagus at the pelvic area, craniophagus at the head. This is the commonest. The number 1 until number 5 is the most commonest. The rest is rare. Okay, for the thoracophagous, is the most commonest conjoined twin, which account about 40%. Okay, this is the story about Azami and Azama. They actually form a thoraco-omphalophagus twin where they conjoin at the abdomen and chest. They actually share liver and had single gallbladder, and the bowel also fused. They underwent 19 hours of operation at Hospital Kuala Lumpur at a hospital at age of 7 months old. And subsequently, they're able to live a normal life, except for the Azami. Azami, she had a bit of kyphoscoliosis. The second commonest is omphalophagus. This is the premature twin that we are separated on 19th of March. So how wonderful the life when they're able to live a normal life subsequently. The third one is pyophagus, where the twin actually fuse the joint at the back. So account about 18%. So remember, this is the famous former conjoined Ahmad and Muhammad. They were separated at age of 4. This is before they get separated at King Fahad Hospital in Riyadh, funded by Allahyarham King Abdullah. And actually, the separation is very extensive, but you see the result is quite wonderful, right? So one of them actually went to able to complete their study and just recently graduated from MSU. So another example is ischiopagus, which account only 6% of all conjoined twin. One of the historical successful separation in 2012, also by local expert, this twin Mu'aymin and Mu'aman and Mu'aymin Ali. They were separated at age of 15 months old, and actually life depends on the stoma bed lifelong. And craniophagus 1 to 2%, but I have no input on this type of conjoined twin in Malaysia, conjoined twin separation in Malaysia. So not all the conjoined twin we can separate. Depends on the severity of the shared organ, especially the vital organ like heart, lung, and all. Like in this case, they actually quite significant sharing organ between these two. So they are considered as one body but two souls. So we move on to the case that I would like to share with everyone here. The first premature conjoined twin separation in Malaysia. This is the first, was done in Hospital Tunku Azizah on 19th of March 2022. A little bit of history, they were actually, this twin was diagnosed antenatally and subsequently born premature at 33 weeks, 5 days via emergency caesar with a birth weight of 2.7 at Hospital Permaisuri Bainun, Ipoh, Perak. But initially, they were quite stable, and we planned for elective separation at a later age, like after 3 months. But Unfortunately, at day 17 of life, they actually had to undergo emergency separation because of significant extrauterine twin-to-twin transfusion. They actually was transferred from Hospital Permaisri Bainun to Hospital Tunku Azizah because of the expert issue. So before the operation, we have to delineate the operation from beginning. We have to start multidisciplinary discussion regarding the timing of surgery, the person the person involved, what are the anesthetic procedure for this patient, and what kind of surgical procedure by the surgeon, and last but not least about the pre-operative and post-operative neonatal care. So this is anesthesia set up 1 day prior to op. If you notice here, there are two sets of equipment with color coding equipment, color-coded equipment. We have 2 GA machine, 2 monitor, 2 trolley for drug preparation at the back here, and also 2 set of infusion pump and also warming devices. So another setting from other place, they actually set 2 operation tables side to side. But for us, we do at the separate. If you notice here, there is one connecting table, connecting door to the next operation theater. So if one of the after the separation done, one of the twin will get transferred to the next OT, and another group of team will continue with the operation. This photo is taken on the day of the operation, at the start of the operation, Saturday morning. So anesthetization, where is the tiny little twin? This was taken during the intubation because of awkward position of the baby. The baby actually facing each other. So we had some difficulty to intubate the baby, but fortunately we able to intubate with a single attempt. For this kind of case, for anesthesia, for this premature twin, we have to anesthetize the baby simultaneously because of the twin B on the orange orange color, the twin B on the left side. They are the twin B more sick than twin A, so we have to intubate the twin B first while maintaining oxygen and mask ventilation for twin A. And after intubation of twin B, immediately we have to intubate the twin A. So after intubation, another difficult step was looking for intravenous access. Remember, this conjoined twin was only 2.7 kg. Can imagine how tiny the vessels are. While attempting IV access, we have to make sure that the core temperature is maintained, because this is small premature baby and they have the tendency to lose the heat quite easily. So we have a warming device here and underneath also. So after almost 3 hours of anesthesia time, we able to give green light for surgical team to continue the operation. So this photo was taken in the middle of the operation. From this angle, we can see it looks like just our normal routine operation. But everyone actually was busy with their tasks. So this is the intraoperative photo. So look at the first photo on the left here. So the twin A, this is the twin A, and this is the twin B. You can see here the liver actually were fused. So they joined at the liver, but fortunately all other organ actually separated. So after this, the subsequent photo, actually the moment before they got separated, it took about 66 minutes from 66 minutes by surgeon to complete the separation from skin incision. So this photo was taken just before sending back twin A. Twin A finished first because less sick twin compared to twin B. So this photo was taken before sending back twin A to NICU. So you can see the satisfaction from the team here. And finally, the twin B was out. It took a while, but Alhamdulillah, it went well. And this conjoined separation actually had gained attention nationwide, including from Istana Negara, from our Queen, Tunku Aziza. She actually visited the twin after the operation. This is the parents of the twin. And this is our DG in our former Ministry of Health, Mr. KJ. So this is the joy that we are shared together. After about 3 months in hospital, they were able to discharge home healthy with good weight, which is 3 kg each of the baby. They are named Dylan Hope and Given Hope because of we are hoping for the best for the baby. And this is my last slide. As a conclusion, pre-operative management of a conjoined twin requires a multidisciplinary approach and teamwork. The anesthetic management of this rare condition, though it's stressful, is always a very challenging but rewarding experience. Without careful planning and delineation of responsibility, there will be a chaos. We all better when we work together, and working together is success. With that, I thank you.
Thank you, Dr. Zubaida, for special Spendy's presentation just now. Now we go to Candy session. Is there any question from the floor? In the chat board, there is a question. If there is no more question, I would like to invite Dr. Noraini to give a certificate of appreciation to Dr. Zubaida. Please come. Thank you. So we end our CME today. Next week's CME will be presented by physiotherapy team. The topic will be announced later. Thank you and goodbye. That's